welcome to the Investor Voice. This is a KLAS Research podcast. I'm Justin Long, Director of Investment Advisory Services here at KLAS Research, and I'm your host. This year, I'm very excited about 2022 and this new podcast that we'll be launching. We'll be focusing on several topics over the course of the season, with today's being on revenue cycle management. This podcast will share data and insights for our healthcare investor. And I am joined today by Dustin Cragun, one of our research experts here in revenue cycle management. Thank you for taking time and sitting down with me.
Of course, thank you for having me.
And Dustin, I think before we get too deep into our conversation, it's important to know you've been in this industry quite some time. You don't look it by any means, but prior to KLAS, you were, from what I understand, almost 2 decades on the provider side of revenue cycle management.
That's right. Spent almost 20 years doing revenue cycle management, seeing the ins and outs and all of the processes associated with that.
Well, I can't think of a better person to be sitting down with the wealth of experience that you have today. And, frankly, as we look at revenue cycle, and I think healthcare as a whole, we hear this all the time. Healthcare kind of trends about 10 years behind as far as the adoption or utilization of technology. And it's just simply, it's very complex, this industry. And then when you get into revenue cycle management and all the different layers of pre-bill, the claims, managing that claim, trying to get it to an adjudicated claims, the post-bill, it's very, very cumbersome, it's arduous. And so I think maybe a great place for us to start is when we look at this revenue cycle, this digital transformation, if you will, that's happening, maybe more broadly. Can you kind of tell us what's happening there?
Yeah, no, it's a great intro. So really, when you look at revenue cycle, it's just a confluence of so many manual processes and complex processes. So you have processes that the payers are putting out and the requirements around health plans and the different payment models. Then you have all of the challenges that the provider may have internally with hiring staff and training staff. And then on top of all of that, you have disparate systems that you're trying to feed together and get data to flow basically from A to Z. And so when you look at that process and you look at how cumbersome it is, we have historically in this industry solved that problem with manual labor. Well, that's not sustainable, especially in today's climate where it's really difficult to find staff. And so because of that, you're starting to see so much injection of digital transformation tools to try to weed out these manual processes, which one, increases the performance or the accuracy of the data, because let's face it, human beings do make mistakes at times. And so you have the ability to reduce errors, but also remove that labor, which is much more costly than running a bot, 24 hours a day, 7 days a week.
And then ultimately, I think you're maximizing your resources as well, right? Taking these folks from maybe some of the tedious task. We're hearing a lot about AI, right? And ML and robotic process automation, more and more. What's driving this?
Yeah, so I think you go back to, again, those manual processes that we're seeing so much of. But in particular, you've got the revenue cycle management piece of a hospital system, and then you also have the clinical side. And I think there's a hesitancy of putting that too quickly into the clinical side because everyone's a little bit nervous about what are the outcomes going to be if it's a true clinical intervention. Whereas on the revenue cycle side, it's just administrative burden and it's just an overhead associated with it. And so I think everyone is much more comfortable shoving this technology in there and then looking for successful use cases. And I think that's really where that's driving towards. Now, I think certainly in time we're going to see a lot more clinical use case. There are some now. It's just I think we see it much more on the administrative heavy revenue cycle side.
So, and maybe let's double click on that a little bit, where you're seeing that in that area. Where are maybe some successful use cases? Automation is what we're talking about ultimately. Where are we seeing a lot of that activity or successful use cases?
Yeah, very good question. So I'd say the last couple of years, we see mostly areas like claim statusing. So really understanding what is the status of all of these claims that you've submitted and you haven't heard anything back on them. So there's that. There's obviously the denial management piece. So when you get denials and trying to manage and figure out what's been denied and what you have to do to fix that. So Other areas are low balance adjustments. So these redundant processes of trying to get rid of these small balances on your GL. But the area that I think we've seen the most growth in the last year is really around prior authorization, which is it's an own beast entirely.
Okay, yeah, that is its own beast. And I know you and I have talked about that in previous conversations. There's not necessarily, it's fairly nascent still, right? And there's not anyone that completely has it figured out at this point, but why is it so attractive to innovation?
Yeah, good question. In that when you look at the number one cause for denials from health systems, it really comes from prior authorization, either not getting it or getting the incorrect data associated with that claim. And so because of that, anything you can do to minimize the amount of denials, you're going to do. And the automation plays perfectly in that, because essentially what you're doing is trying to understand what are the rules that the payers have, and then submitting a request based on those rules and then bringing that information back. One of the challenges that we see in this area is that payers are changing their rules all the time. And so because of that, staying on top of the prior authorization rules and switching plans quickly, like having an individual go from one plan to another and a totally different set of rules, is very hard for them to keep track of. So this automation can really help bring forward the rules and help them understand what do they need to submit to get a successful prior authorization.
Kind of the old adage, garbage in, garbage out,
Sure.
right? If we can mitigate that on the front end, absolutely. What you're saying makes a lot of sense. You know, everything we do here, as we know, centers around the provider. We serve many different groups, our vendors and our investors, and this is the podcast that is focusing on our investment community. But as we look at providers, and you're talking about prior auth and automation more generally in rev cycle, where do you think are areas that maybe they need to consider a little bit more? And then as far as the tools that are available, what should they be considering with some of those tools?
Yeah, great question. Providers, when you look at their ability to adopt technology, are really across this wide spectrum. So some are very much advanced use cases and have the internal resources to be successful in those efforts. And you have other providers that are maybe just starting to dabble. They're coming just off of fax machines and emails and some of those other slower processes, if you will. So I think the biggest thing that I hear from providers as I speak to them is really having a great understanding of what resources they have internally. And it's not just the financial resources about, can we do this? Can we pay for this? It's really, do I also have the internal expertise to help different groups guide me and lead me on my unique processes and automate those so that they fit within my workflow. And I think that's probably one of the bigger disconnects that we see from our provider friends. They mean well and they intend well, but this is a fairly heavy lift at times if you're not sure exactly how to do it or what resources are needed.
So maybe not some hand-holding, but some guidance there in this process. And then from the tools that are available, I mean, do we, again, not necessarily being too specific, but we have data that shows vendors are performing very, very well in automation, specifically in RPA. Is that correct?
That is correct. Yeah, I think first and foremost, the message is this technology is here to stay, right? I kind of look back to almost like the automobile industry. I think if you go back 10 years ago or so, the idea of like driverless cars kind of made everybody really nervous, and we thought that's probably not going to happen. Well, what we're seeing is this natural progression of it's really driver assist, right? And then in time it may be driverless, but we're not totally seeing full driverless cars yet. And so I think you can follow that same path with where we're at in healthcare, which is we have a lot of tools to assist providers, tried and true tools that work very well. And I think there's more advanced tools that are coming, that are emerging, if you will, and they're happening, and then we will see successful use cases, but in many ways we're still trying to figure out what that is. And so like AI or machine learning is a really good example of that. There are very much successful use cases in that, but when you look at really complex use cases with this complex technology and algorithms, I think we're still trying to figure that out fully right now.
No, that makes a lot of sense. I think you had mentioned recently there was one of our data sets or some research that we had done had looked at where the allocation of monies was going as far as, maybe you can kind of just give a little bit of a teaser in that.
Yeah. So what we're seeing right now is still a tremendous amount of money in the business office, so revenue cycle right? And the patient access areas, so kind of patient engagement, those areas. There's really pretty good investment happening in HR and supply chain, but not near as much. Probably like a 3-to-1 type ratio if you look at the data that we're getting back. I really expect that to continue in that magnitude. I think as organizations become more astute on how to apply the technology, you'll see more advanced use cases. But it almost seems a little bit simplistic. Really, it's about how can you recognize where you can use this technology and then putting it in there and making it work. And there's so many different areas that you can do that right now. It's almost a little bit of take your pick. And we tend to still migrate towards revenue cycle.
Makes sense. That's helpful. You know, I'm an investor and that's listening to this, and they're saying, all right, where should I maybe ask what questions do I need to ask? Maybe is a better way of saying it. If I'm looking at automation, and you've talked about prior auth, but it doesn't necessarily need to be prior auth. What questions should I be asking if I'm looking to invest in this area?
Yeah, for sure. So when we look at organizations that do this really well, I think it's two fundamental parts. So the first part is the actual technology, and is that technology a good technology? And we actually see a lot of that. I think there's plenty of really great tools that are available. Where the challenge comes is that real skill set or that knowledge base of how do I take and I use that in healthcare? Because healthcare is its own animal. It's a very unique industry, including the revenue cycle piece that we'd already spoken about. So you have to have an organization that is able to take really good technology and really deep understanding of healthcare and bring those together and be able to maintain that. And those groups that can do that are doing very, very well. I think those that struggle, well, they struggle.
And they may have great technology to your point, but simply don't have that back-end support.
To apply it. Correct.
Makes a lot. Where, as far as emerging efforts, where are you seeing, again, you've touched on some of those. Is there any areas that maybe you haven't shared with the audience that you're seeing as kind of innovative or emerging in this space?
So, well, interestingly, you know, my response to that is I think we're still such on the tip of the iceberg with what's happening right now that I really still feel it's a wide open field. I mean, when you look at all of the workflows that can be automated in healthcare, I mean, we're only talking about a handful of really successful use cases. When I say successful, I just mean ones that we see fairly often and frequently in healthcare, because there's certainly groups that are doing some very unique and specialized type initiatives. But from a general perspective, it's still very wide open. So I would expect to see really more of what we're seeing right now, which is the revenue cycle, their prior authorization. But what I think we will see in time is right now, most of the technology is still creating like exception-based workflows where an individual actually has to now do a manual intervention to either rebill a claim or do some different things with it. I think in time, we're going to see the technology actually be able to automatically resubmit the bill like on a very consistent basis, like understand what needs to change, what can be documented and supported so the claim is not deemed like fraudulent or in error and gets rejected. So I think when we break into that level, we're going to see some pretty amazing things happening.
No, that's really great. And I think that's my last question was going to be kind of put your forecasting hat on. Yeah. And nobody likes to have a crystal ball. So this is going to be my second to last question because I think it's a good segue. Is where do you see in the next 3 to 5 years automation and particularly rev cycle category going?
Yeah,
I know I'm putting you on the spot there a little bit, but just you're so deep into the research, you do have some pretty good handle on where you foresee some things outside of what you've just shared with me.
Well, it's a very practical answer because, you know, here at KLAS, when we're talking to providers all across the country, and I mentioned earlier, they're all on completely different ends of the spectrum. So I think you're going to see kind of a loose number, that 15-20% that are really operating in this embracing digital technology as a competitive advantage. And they're going to be doing some things that I probably haven't even heard of yet, that they're really trying to remove people from that process altogether. But I think you're still going to see that real middle, that 60% probably, that are trying to embrace technology and trying to figure out, they're going to still be doing these, these general automation that we're hearing over and over, the claim statusing, the denials management. I expect to see very much the same. And then I think that remaining percentage, I think they're still trying to figure out, can they use technology? Do they have the resources to do that? And hopefully, they come along as well, because again, at the end of the day, this technology is here to stay.
Absolutely. No, that's, I think, really important for our investors to hear, because again, there's a lot of activity going on, as you well know. And I think, to conclude, the question the investors would love to hear is, as we work with investors, some of them are looking just to get smart on a particular segment or category, right? Who the players are, kind of better understand what's happening in the marketplace. But then there's those that are more into a deeper engagement with KLAS, and they've identified a target. They want to make sure that they have the right investment, the right asset. As far as upcoming research, I think this will play a really important role with our investors. Maybe give us a little bit of insight. And again, I know there's a lot going on, but let's just say over the next quarter or two, what can we expect to see maybe from your team?
Yeah, we're going to be bringing in more automation vendors onto our website, so there'll be a lot more data to look at. And through that data, you also get different use cases and different things that people are doing, which always increases our collective knowledge. The other thing that we're going to be doing in 2022 is a report specifically on prior authorization, based on the reasons we mentioned earlier, which is it's just such a hot topic right now. And we're seeing a tremendous influx of vendors who are doing that automation process, that we felt like it was time to really start to figure out, okay, who's doing it well? Who has the broadest payer base, for example, the least amount of interventions, manual interventions, those kind of things. So we're really excited about that report, probably middle of next year.
Okay. And then any emerging vendors, innovative vendors that will be spotlighting that I would imagine, yes, right?
Yeah, we're always looking for those, and we have a couple that we're looking at right now. So we'll continue to publish those reports that will shed a light rather on those vendors that are emerging and coming out with great technology.
Kind of discern, again, is it vaporware, or is it really, are they gaining traction and making a difference in the marketplace? Dustin, always a pleasure to sit down with you again, not necessarily in this forum. This is our first time doing this, but I hope we can do this again.
Yeah, for sure. Thanks for having me.
Thank you. To our investor community, thank you for listening. If you have further questions on prior auth, automation, RPA, any of the categories in revenue cycle management, or any segment that KLAS currently monitors and measures, which is about 130 plus segments, feel free to reach out to us. Also, if you have a topic you would like to suggest for an upcoming episode, you may do so by sending us an email at investorservices@KLASresearch.com. Until next time, which will have a continuum of RCM with Mac Boiter on documentation. This is Justin Long with the Investor Voice, signing off.